Good evening, everyone.
Good evening.
My name is Wenbin. I'm a student at Houston Community College. I'm going to give you a presentation. First, I'm going to introduce our audience.
Hi, I'm David.
Hi, I'm Julio.
Hello, I'm Patricia.
Hi, Alejandro.
Hi, Lucia.
Hi, Sophie.
Okay, let's start my presentation. First, I'm going to ask you a question. Do you take any medicine recently?
Not really.
Well, sometimes I take Advil.
Advil. Are you using Advil to treat pain?
Yes, I take Advil for pain quite often. Yes.
But do you feel dizzy or do you have headache after taking it?
Not always, but I do get it sometimes after I take Advil.
You do?
Yeah.
Thank
Not
you.
always. Not always.
Thank you, Patricia. Actually, I'm going to say all the medicine can cause some level of side effects. Advil is a good example. It's not a prescription, but all of us can buy it over the counter. It is a kind of ibuprofen to treat pain. However, following unanticipated study results linking ibuprofen to increase risk of cardiovascular events and increase the bleeding in the gastrointestinal tract. We have a new theory. The new theory states that healing is at our fingertips. We can be healthy by doing exercise. Doing exercise such as yoga or Tai Chi is also an economic way to restore our health. So, it is not medicine, but exercise that makes us healthy. So we should be active, do exercise on a regular basis to be healthy. I don't mean medicine is totally useless. Sometimes medicine is therapeutic and effective. Like what I mentioned before, ibuprofen can be used to treat pain. X-ray can show our fractured bones, and the MRI can scan our brains for tumors. And we have to admit, these methods are helpful. However, there are some everyday complaints, such like back pain, headache, insomnia, or nausea. These are the undesirable side effects of the medicine. Well, the side effects of medicine may vary for each individual, depending on age, gender, weight, or general health condition. If you have a headache, you may take an aspirin. If you can't sleep, you may take a sleeping pill without thinking of its side effects. However, if you take this kind of medicines for a long time, you may become addicted to them. Like if you are not able to take a sleeping pill, you may not be able to sleep. In that case, we pay huge amount of money and become addicted instead of getting better. Here we have another case, AIDS and cancer. So far, no medicine can cure AIDS or cancer, and those medicines are very expensive and have many side effects, such as losing hairs or having no appetite to eat. So keep it in mind, even though medicine is effective sometimes, as long as we take medicine, we may suffer its side effects. However, we have new theory. The new theory states healing is at our fingertips. We can be healthy by doing exercise. This exercise can be yoga or Tai Chi, but remember, it is exercise, not medicine, that makes us healthy. First, doing exercise is an economic way to restore our health. You may say, for elderly people, it is better to stay at home. That is not true. Especially for them, it's better to do some exercise at home, such like yoga. Yoga is not just a stretching. It's really about creating balance in the body through developing strength and flexibility. Yoga can be done quickly, increasing heat in the body through movement, or move slowly to increase the stamina. I would say doing exercise such like yoga is good for both elderly people and young people. You may do this in the gym, but you don't have to. For you guys, maybe you want to do exercise at home with your friends, and no heavy equipment is necessary. So it's really a good economic way of healing. Secondly, doing exercise can help us find an emotional balance, overcome the hardships of life, leave the stress of every day, and let go of the everyday's worries. Doing exercise is a very good vent, which accordingly helps us find balance on our emotion and control our thoughts. Not only that, doing exercise has no side effects. Also, a long time exercise is not necessary. 30 minutes is good enough. Okay, so notice, I don't mean you should eliminate medicine. Well, sometimes medicine is necessary. In this situation, be wise to choose medicine. Always consult with your physician about the side effect of the medicine you are going to take. If you don't really need to take medicine, don't take it. If doing exercise is useful and helpful, I would recommend you to do exercise instead of taking medicine. Also, taking medicine is less time consuming than all the time we spend taking medicine for the side effects and for the other reasons. To conclude, medicine is therapeutic and effective sometimes, but all medicine causes some level of side effects. Instead of counting on medicine, we should count on ourselves by doing exercise. Doing exercise is also an economic way to balance our emotion, overcome the hardships of life, leave the stress of everyday life, and let go of the everyday worries. So simple, so easy. So let's take action, do exercise, and maintain a good health. Thank you. That is my presentation. Is there any question?
Well, so exercise is good for everybody at all ages?
Yes, absolutely. Doing exercise is good for all ages.
And you mentioned Tai Chi. Is Tai Chi good for kids also?
Absolutely. Tai Chi is a Chinese discipline. Well, Tai Chi is a very good exercise for all ages. For elderly people, you can play Tai Chi. It will make you stronger. For the kids, it will make them stronger too. And also, Tai Chi can make all of us more flexible, have a better quality of life. So it is a good exercise. And for elderly people, you can do Tai Chi at home too. You don't need any heavy equipment. So just some movements, it is good enough.
Good, thank you.
Another question. Are you saying that exercise or Tai Chi can cure cancer?
No, I don't mean doing exercise can cure cancer, But the exercise is always recommended for those people because doing exercise can help them have a better appetite, which accordingly have a better quality of life. Yeah, it is. No more questions?
No.
No.
Thank you.
Thank you.
Thank you.
Thank you very much.